Good afternoon, folks. Okay, I've got B for you. Now we're discussing cervical epidural, spinal cord stimulation can immediately improve arm and hand movement in some people years after a stroke, with a small pilot reporting an average 32% increase in arm strength and reduced spasticity after a short four-week program. A University of Pittsburgh led pilot trial implanted thin epidural electrodes along the cervical spinal cord in people with chronic post-stroke arm weakness. With stimulation turned on, participants showed meaningful immediate gains in strength and function, and the group average strength rose about 32%. The intervention required fewer than 9 hours of movement-based training over 4 weeks, and reported no serious adverse events in the small cohorts. Neurological surgery, University of Pittsburgh. How the stimulation helps. The stimulation targets sensory fibers in the cervical spinal cord to amplify residual brain to spinal connections, allowing remaining neural signals to recruit motor circuits more efficiently in practice. This acts as an assistive neurotechnological assistive neurotechnology. When the stimulator is on, people can perform tasks, grasping, lifting, using utensils they could not do unaided. Some participants regained movements for 4 weeks after device was removed. People with chronic upper limb weakness, months to years after a stroke, who retain some residual voluntary control, may be candidates. Early reports include very small samples, 2 patient first-in-human reports, and a later 7-participant pilot. So eligibility and likely benefit are still being defined. Limitations and risks. Small early trials. Evidence comes from pilot studies with very small numbers. Larger randomized trials are needed to confirm effectiveness, and identify who benefits most. Surgical implantation required. The procedure places electrodes epidurally in the neck, so it is invasive and carries the usual surgical risks. The pilot reported no serious adverse events, but broader safety data are limited. Not yet standard care. This is investigational, not widely available outside research centers. Practical next steps and questions to ask your care team. Ask about clinical trials at major neurorehabilitation centers. University of Pittsburgh and smaller centers are running early studies. Neurological surgery, University of Pittsburgh. Key questions. Am I a candidate? What are the expected benefits and risks for my specific defects? How long does training last? And what outcomes are realistic? Are there non-surgical alternatives to try first? Early pilot